Hello and welcome. This session is about the 2022 to 2032 plan to end gendered violence. It's the National Plan to End Violence Against Women and Children. Before I proceed, I'd like to acknowledge the traditional owners of Australia and pay respects to their elders past, present and emerging. I come to you today from the lands of the Untitled people in southeast Gippsland. One of the things I wanted to acknowledge is that Aboriginal women and children live with higher rates of violence than any other group of Australians. One of the features of this plan is a special focus group made up of Indigenous people to help to really put a focus on drastically reduce statistic. I'm Joanne Law, Director of Mediation Institute. What I'm wanting to do today is just look at a little bit of the data that's come out of the plan, the key priorities and what's next, and look at a little bit at how that may impact us as family dispute resolution practitioners. If you go to the Department of Social Security website and search for the national plan, the vision is to end violence in one generation. So it's very ambitious. It's a commitment to a country free of gender-based violence, where all people live free from fear and violence and are safe at home, at work, at school, in the community and online. It's a human right for all people, and commit the signatories to the plan and the governments that are involved to ending violence against women and children in Australia in one generation. So I guess it's a little bit like anyone who's old enough to remember Gough Whitlam saying that no child will be living in poverty in Australia. Not really achieved, but by setting high goals, we've got more chance of making progress. And sadly, progress hasn't been made over the last plan. There hasn't actually been an improvement, noticeable improvement in the rates of violence in Australia. And there's actually been an increase in sexual violence, although perhaps some of that is related to people are more willing to say that's happened rather than keeping silent, although we've got a pretty high profile case at the moment, the consequences potentially for someone for speaking up. According to the data, some of this is coming from the 2016 Personal Safety Survey. And I guess one of the things in the plan is that there's going to be a focus on getting better and more frequently available data around family violence. But 1 in 3 women experience physical violence since the age of 15, 1 in 5 experience sexual violence since the age of 15, and 1 woman was killed every 10 days according to a homicide rate. This is appalling. This is killed by a relationship, an intimate partner. The highest risk is for Aboriginal and Torres Strait Islander women and children. Women hospitalised due to family violence 32 times more at a greater rate than other women in Australia. And children are 7 times more likely to be subjected to child abuse and neglect. So those things are related. Now, this isn't to say that violence doesn't affect men. This isn't to say that all violence is gendered violence caused by men against women. What it is saying, though, is it is the largest and most preventable sector of violence in our country that can be addressed, I guess. So that's why it is such a high area of focus, and rightly so. You may not be able to read this clearly, but it's the business case for preventing violence is massive. 26 billion a year is estimated as the cost of violence, and this is just directly against women and children. All forms of violence against children would increase that. So it's costly in human terms, it's costly in financial terms, and it is, according to this plan, a high priority for the government. These tables are from the plan, so I'd really encourage anyone who's working with people to download and have a look at the plan. Some of the data there is the drivers of gendered violence. 4 major drivers that were identified was condoning of violence against women, so looking the other way, seeing it as trying to help her know her place, or all sorts of things like that. Another driver is men's control over decision-making and limits of women's independence in public and private life. And there's no coincidence that there's a higher risk of violence when women are pregnant, and also at times of separation where that control is broken. Another driver is seen as rigid gender stereotyping, and those are sometimes called toxic forms of masculinity, where men are trying to force women to fit into a mould of what they see a woman should limit herself to. Also, toxic male peer relationships and cultures of masculinity. Some of our very male-dominated organisations like football and so on are working quite hard to try and manage some of those issues. It's not that gendered violence is separate to other forms of violence and discrimination. And one of the things that is highlighted in the report is that intersectionality, that crossover between other forms of oppression such as racism, ageism, liberalism, classism, and all of the other isms that relate to discrimination against people. These are quite useful in understanding context and recognizing that violence against an individual isn't just an individual problem. It's not just two people having a fight. It's not independent to the context that it happens in. So some of the reinforcing factors are general condoning of violence. So male violence against males, males violence against females, all forms of violence create that environment where it's more likely that someone's going to use violence rather than other methods. Experience and exposure to violence. We know from research people that are victims, survivors of family violence as children are much more likely to be victims of violence as adults, significantly higher. I haven't got the actual numbers from the studies right here, but we know it's a risk factor. Poverty, natural disaster, alcohol, gambling, all of those are correlated with family violence. They're not the causes, but they're factors in. So for those working with families, with people, increasing risks associated with financial pressures at the moment on housing. So there's a lot of people that are stuck living separately under the one roof because they literally can't find somewhere else to live, to separate. Those are all creating environments which reinforce the risk and increase the risk. And another factor is resistance and backlash to prevention and gender equality efforts. So if you've ever engaged in some of the really extreme men's rights groups, you'll see that there's some really aggressive gendered language being used that are identified as contributing to these risks. So social norms are certainly seen as a factor. So to save you having to read the full 144 pages of the report, some of the key points that I took out is that it's preventable. It's the main preventable risk factor contributing to illness and death for women aged 18 to 44. It's the highest risk for women in that age group. It's also a leading driver of homelessness, incarceration for women. The plan to prevent gendered violence addresses the social, cultural, political and economic factors that are driving. So some of those factors I talked about just a moment ago. And it's really focused on ending gender inequality more broadly, not just within intimate relationships, rigid gender norms and gender-based discrimination. Quoting out of the plan, to achieve this, we must reshape the social, political and economic aspects of our society that allow gender inequality and discrimination to continue. There's a reduction in some of the attitudes that support violence, and most Australians say that they support gender equality. But over the last 10 years, the previous national plan, it hasn't actually, or 12 years, it hasn't actually resulted in a reduction in violence rates. So the principles of this plan are advancing gender equality, closing the gap. So there's a significant focus on the health and also family violence burden gap for First Nations Australians, Aboriginal and Torres Strait Islander peoples. It's centred on victim survivors, so really working with using the lived experience, the knowledge that comes from people who have experienced family violence, looking at accountability for users of violence, remembering that it's the choice to use violence, not anything that the victim survivor has done that's the cause of the violence. Intersectionality, so those crossovers between the various causes and influences and effects of what's occurring with violence. And very much looking at person-centred and coordination and integration between the various aspects of the system, which anyone working within the system know that sometimes are not perfectly coordinating themselves. There's going to be a Domestic, Family and Sexual Violence Commission, which has the role of national coordination and consistent monitoring and evaluation of frameworks and annual reports to Parliament. A commissioner was appointed 2 days before the Parliament went into caretaker mode. That appointment's been overturned by the new government. Rather than an appointment, they're using a open application process. So there's an interim to finalise who that commissioner is going to be. The 4 domains that they're looking at are prevention, early intervention, response, and recovery and healing. We'll just have a quick look. So prevention is about stopping violence before it starts. And that's really looking at changing the environment that supports violence. So challenging condoning of violence against women, advance the gender equality, and listen to First Nations people. So the Aboriginal and Torres Strait Islander Action Plan is going to be developed for and by First Nations people so that it's culturally appropriate and trauma informed. That's the intention and part of the Closing the Gap strategy. Support for men and boys. Some of the criticism that was levelled at the previous plan is that men were demonised rather than supported in some ways. It's all around building healthy masculinity, positive supportive relationships within male peer networks. So that's going to be fun work. Harnessing technology. We've seen and in technology enabled abuse and use of images and so on. So working to help to prevent violence using technology. And also elevating the voices of children and young people. One of the criticisms was that they are seen as kind of ancillary attachments to their mother, whereas they're really looking at children and young people as victim survivors in their own right, and that they should have their own voice. Invest in making workplaces safer from sexual harassment and other efforts. So with the early intervention, it's about stopping violence escalating and preventing it reoccurring. So once it's identified, don't just, oh, well, that's happening. It's about let's not have any further incidents. And some of those are about reducing the long-term impacts of exposure. So we know as far as the harm that children experience from exposure to family violence and ongoing conflict, the longer it goes on, the more harm is caused. So if we're able to stop exposure as soon as we're aware as a system and as a support services, then that's going to make a big difference rather than waiting till it gets too extreme or life-threatening. Addressing adolescent violence in family settings. So children can be also perpetrators of violence, and sometimes that hasn't been dealt with as well as it needs to be. And certainly where there's evidence that children that are exposed to family violence are more likely to be victims of family violence, they're also more likely to be perpetrators. So we've got those 2 risks coming out of living in unsafe environments. Improve responses. So responding more quickly to newly identified cases of violence, an attitude that may prevent services or interactions occurring to help prevent it. There's some talk about resources, and because that's the immediate thing that comes up. Child protection and other services are often overstretched and really crisis managing. And so that's been recognised as a risk for violence not being prevented early or continued violence. Enhancing accountability. So once again, issues around misidentification of perpetrators. So those of us that work in family law know that there's often accusations and counter accusations, and it becomes very confused about what's actually occurred. So I'll be interested in seeing what their strategies are to deal with that. And building capacity. So identify and support women and children at increased risk of experiencing gender-based violence. And some of that's related to risk factors that we've been able to identify from research, but also improving the research. So the next one is response. So efforts and programs used to address existing violence, and that issue of coordinating frontline services between the states and territories and the Commonwealth, and making sure that there is a skilled and qualified workforce with consistent rules and guidelines across boundaries, which is work that has been happening, but I don't think we'd be able to say that it's work that's been finalised across all areas. Diverse communities, and so that's understanding the specific challenges of diverse communities and addressing those effectively. So some of that may be fear of authorities that leads to people not disclosing, and issues such as that, which is one that's often identified. Safety for women and children escaping violence. I still question why are they escaping and not the person who's using violence removed. But anyway, we'll set safe and secure housing from crisis accommodation to longer term sustainable social housing is the approach that's identified in the report. And of course, improved justice responses. So those are the kind of 4 pillars of that. And recovery and healing. So support for victims and survivors, specialist recovery and healing services for sexual violence, which isn't always dealt with as effectively as it could be in terms of supporting victims, survivors. Tailored recovery services and support. So once again, acknowledging that diverse populations have different needs, and they may need services that are more fit for purpose based on age or where they are. And again, recognising that children and young people are not just miniature adults, and their needs may be different, and they are victim survivors in their own right. There's going to be a victim survivor advisory group which will guide the implementation of this recovery and healing. That sounds like it's quite a positive thing. Sexual violence has increased in all settings, which is really concerning. Some of the focus that was identified was busting some of the myths and victim blaming narratives, including some people's beliefs that sexual violence can't happen within an intimate relationship. So identifying that rape in marriage is definitely a valid concept, and once you've signed the contract, you're not a sexual slave. And clearly the issue of barriers to reporting sexual violence, the high attrition rates when they are reported, and the low prosecution and conviction rates if a sexual violence case does make it through into prosecution. So that's all been identified as factors affecting. So lifetime prevalence data indicated 51% of women in their 20s had experienced sexual violence. At the back, it's got all of the research reference. So those that are doing our graduate diploma course, you'll find that this document is very, very useful in terms of referencing the most recent studies and reports into these areas. So identified as a whole of government, or rather whole of society, and they've specifically named these sectors as needing to be part of this work. So including the media, and workplaces, and so on, right down to communities. So I hope everyone will be part of this process. With regard to measuring progress, I've only just put a little bit out of here. If we were in business, we'd be talking about lead and lag indicators. Some of the lead indicators are changing the environment, so reducing mistrust in women's report of violence, and so on. You can read that. It'll be interesting how they work out how they're going to measure those reductions in rigidly reinforced gender roles, for example, I suppose surveys and things. Now, with the family law and family violence courts, they made mention of a couple of reports into the family law system that had seemed like they were dead and buried, but maybe are not. It mentions that more will be done to make the family law system safer and easier to access. The Australian Law Reform Commission Family Law for the Future inquiry, which was provided in 2019, and then the following up a joint select committee of Parliament, that neither of those kind of went anywhere. And then we had a merger of the family courts, which was a different kind of pathway taken by the previous government. So it'll be interesting to see what comes out of here, but it seems like more changes to the family law system are provided for. And there's also a mention of restorative justice processes with victim survivors and perpetrators. So it'll be interesting to see what happens there. It's not something that everyone welcomes, but certainly for some people it can be very helpful in moving past what's happened. And access to justice. So really, once again, highlighting, identifying and removing barriers to investigating and prosecuting violence against women and children. And that includes ensuring training and tools for police and for police prosecutors and other prosecutors, I suppose, and strengthening responses to perpetrators. So for those of us working in this sector, I guess my reading of the plan is that we'll be expecting to see some more changes coming.
Okay, well, thank you. I hope that you will look for the report and have a look at some of this in more detail. We'll continue to share as the plans are developed and we see a little bit more substance on what changes are intended in order to achieve this very worthy goal of preventing gendered abuse and violence in Australia. I'm Joanne Law, Director of Mediation Institute. If you are a dispute resolution professional, please join us in the network. The address is there, and be part of the conversation as dispute resolution professionals as we work together to prevent abuse and violence.